which you'll hear about more after the talk. I'd like to encourage the planning team to remain visible and also recognize them. If you would please stand so that we know who you are. And our volunteers. Thank you all so much. And we'd also like to thank our Marine founder and overseer, the Dr. Pastor Curran B. Lee, as well as our campus pastor, Darrell Barrett. I will now introduce our speaker of the hour, Dr. Donovan Christie. Dr. Christie is Jamaican born, and he grew up in the Bronx, New York. He is a fellow of the American Academy of Anti-Aging, Functional and Regenerative Medicine, also of the American Academy of Pediatrics, as well as the American College of Physicians. He holds a certificate from the American Academy of Allergy, Asthma, and Immunology. Dr. Christie founded Anwan Wellness Medical Center, PC, the Anwan Regenerative Center, and the Picture of Health Foundation, Incorporated. He's been in practice for over 30 years. Dr. Christie is passionate about preventive medicine, as that practice focuses on integrative and functional medicine. It utilizes lifestyle interventions, including nutrition, exercise, spirituality, immunotherapy, nutraceuticals, hormone replacement, regenerative stem cells, platelet-rich plasma therapy, detoxification, intravenous nutritional infusions, chiropractic and massage therapy, as well as acupuncture and pellet therapy. Dr. Christie received his MD from the Albert Einstein College of Medicine in New York. He is board certified. He's quadruple board certified in internal medicine, pediatrics, preventive, and regenerative medicine. He is an author, educator, and chairman of the Picture of Health Foundation, whose mission is to educate the world on healthier lifestyles while serving impoverished nations with short-term medical outreach trips. He's traveled to many countries in West and Central Africa, as well as South America, delivering free health care to needy residents. He's inspired many through his annual 5K walks and runs, which encourages people to move and get healthier, as well as through informative presentations at events such as ours. Please help me in welcoming Dr. Donovan Christie to the stage.
Thank you so much. I wanted to start off just by reading a text that one of my guys in my men's group sent me this morning. It says, God says, trust me, and everything will work out. I am in complete control. I will not let any of your problems overtake you. I will cause you to be the winner. Philippians 1 verse 6 and John 16:33. So that's been my mission, really, is to educate the population on healthier lifestyle and let everyone know that God put everything here on earth for the betterment of men. My topic today has to do with heart disease and how heart disease impacts African Americans way more than the other races or population. So let me start with my first slide. Right. Okay. What do you think causes heart disease? High blood pressure? Yes?
Yes.
High cholesterol?
Yes.
Yes. High blood sugar?
Yes.
A stressful lifestyle?
Yes.
Exactly. So, why then, I mean, everybody experiences those. Why are African Americans so much at a higher incidence of heart disease? What do you think? Give me one reason why you think we're more
Because
at risk.
our lifestyles aren't good.
Right.
Access
I-
to genetics.
Genetics, yes.
Yeah, that's
What else?
access to healthcare.
Access, yes. And I'm going to discuss all of those, but you guys have a good idea of why there's this disparity or discrepancy among the races. So I'm going to get into the disparities, the incidence, and the contributing factors. And here's my agenda. I'm going to talk about what heart disease is, which we discussed briefly. And then I'm going to show you a slide that looks at the incidence of heart disease amongst racial groups. I'm going to talk about some of the factors that contribute to the disparities. And then I'm going to address what we need to do with programs like this, what we need to do to educate the masses so that we're not at risk for early death. So let's talk about heart disease in the United States. Here's the definition. When people say heart disease, you usually just think of a heart attack, right? What is a heart attack? You have blood vessels that supply the heart. Those blood vessels are important to provide oxygen and nutrients to the heart muscle. If those arteries that are called the coronary arteries, if they are blocked, you will get a heart attack, right? Now, I'm going to show you another slide that talks about the incidence. The incidence of heart disease is going up, but the survival is also improving. And that's through technologies. You know, they do the Roto-Rooter with cardiac catheterization and stents and all these temporizing things. But I'm not big on intervention. You know, my grandmother always says, prevention is better than cure. Just because you have all this technology doesn't mean that you should be taken advantage of. You know, you can eat right, exercise, manage your stress, and prevent heart disease. So coronary artery disease is the main type that we'll talk about. Then there's heart failure. And you can get heart failure just from having high blood pressure and the heart working until it's so tired that it loses the strength or the contractility of the heart. Fluid then backs up into your lungs, you get short of breath, it backs up in your legs, you get ankle swelling, congestive heart failure. Most common, hypertensive heart disease, as well as coronary artery disease, which causes damage to the muscle. So those two. You can also have arrhythmias. You guys may have heard of atrial fibrillation, ventricular fibrillation, ventricular tachycardia, all sorts of arrhythmias that can lead, that's considered a heart disease. Some people, unfortunately, they're born with heart defects, ventricular septal defects, tetralogy for low. They'll have anomalous venous return. That's a congenital thing. They're born with one of these heart that's not normal, and they can have problems. But that's way down on the list. The most common one is coronary artery disease, and that's caused from our lifestyle and aging. $805,000 heart attacks in 1 year in America. How many of those you think are black people?
9%.
It's not that high. We only make up 20% of the population. And we have a 30% higher incidence of heart attacks than Asians. or whites. So what are we doing wrong? I'm going to say it's not all our fault, but we definitely have a big input into that. Let's look at some numbers. I talked about the amount of cases of heart disease. Is this a pointer?
It's not infrared.
The red,
He doesn't have the dot.
oh, it doesn't have the dot. Okay, so just look at this slide. I just want to tell you that in 1990, we had over 250,000 people dying of heart disease. And the prevalence, which is 6.2%. Now, if you go into the 2000s, the first 10 years, we got better care, more technology. The mortality rate dropped from 250,000 to 190,000. But the prevalence, which is the amount of cases, increased to 7.1%. Yes, we're surviving more, but more people are having it. Then you go to 2020. The mortality declines even further to 170,000 in a year. But the prevalence rose to almost 8%. So what's causing it? We're living longer, so when you age, that contributes to the elasticity of the blood vessels. You can get calcifications of the blood vessels. So when you get in your 80s, 70s and 80s, you're gonna have some hardening just from age. But a lot of it has to do with the fact that we are more obese now than ever before. The incidence of obesity, the incidence of diabetes, has all just kept on going up and up and up. Our food supply has been altered. We eat genetically modified foods. We have foods laced with pesticides and herbicides. We have hormone injected in our meats. Hormones are growth factors. They make things grow. Cancer rates gone up. Autoimmune disease has gone up. Autism has gone up. So our food supply has a big impact on that, all right? So let's look at it when we compare other racial groups. I mentioned before that we have 30% higher heart disease incidence compared to whites and Asians and Hispanics even. Our mortality is higher. Even though the overall mortality is going down, mortality for heart disease for African Americans is higher. Is that because we don't go to the doctor? Access to care is a big thing. So we have worse outcomes should we get the disease, and we get it at a higher rate than whites. Higher prevalence of high blood pressure in our population, higher obesity in our population, higher diabetes. Obesity and diabetes usually goes hand in hand when you're looking at the trend. And then we have healthcare access, whether we're in the rural areas or the urban areas. We just can't find providers or doctors and nurses that are truly dedicated to our lifestyle and understand our socio-economic situation to provide the care and the guidance needed to reduce heart disease. There's lots of programs that are trying to change the disparity, but this is something, I've been a doctor for 35 years, and this has been a problem the whole time, and I haven't seen it getting any better. You know, we just have higher rates of everything. Look at this slide. So when you look here, you see that African Americans, 85 per 100,000 people. 85. The closest are white folks, and they're at 35, 36. Hispanics are at 32, and Asians are at, say, 31. This shows that we are not only faster than everybody else running, but we also have more heart disease. So we have good genes and we have bad genes. I'm going to talk about some of the bad genes that we have. But a lot of it really has to do with the way we cook our food, the quality of the food that we're putting in our body, and how we manage stress. And guess who's more stressed? Is it us or the majority folks? We have more financial stress. We don't have generational wealth. A lot of us don't. So we have more disease. Acknowledging that is the first step to improving it. Now the stroke belt. Tell me one state that's in the stroke belt. Anybody?
Georgia?
Georgia. Mississippi. What else? Come on, you got them. There's 8 of them. Alabama. Kentucky. What else? North and South Carolina. Louisiana. I think we got them all. Where are all those states located?
In the South?
In the South. So we are in the stroke belt. Look at the numbers. 8.2% in the stroke belt. The non-stroke belt, southern states, they're next at 6.9% incidence. And the rest of the US, Northeast, West, they have half the incidence of heart disease than the stroke belt. 4% versus 8.2%. So what are we doing down here in the South?
Crying.
We're frying. We're frying. We're putting batter on our food. We're adding salt, lots of salt. Southern cooking.
Okay.
Soul food.
No exercise.
No
It may taste good. It may taste good. We know how to make food taste good.
Yeah.
Right? We do, don't we? We gotta add salt, the salt of the earth. But you cannot put too much salt on your food.
Yeah.
That's gonna expand your blood volume, because sodium pulls water in, expands your blood volume, raise your blood pressure. And I'm gonna tell you why we as black people shouldn't do it, because we have a gene that doesn't allow us to get rid of salt as effective as the other races. I'll talk about that in a minute. All right, so here are the factors that are contributing to it. We're poorer. I could just say socioeconomic factors, but we tend to have less income, less education, and less higher paying jobs. So because of that, it takes money. I'm doing my 12 Weeks to Wellness program. One of the things I talked about last week was that it's expensive to eat healthy.
Yes, yeah.
Is it more expensive to cook food at home, or is it more expensive to eat out?
It's expensive to eat out.
It's debatable, right? It depends on where you're eating out, right? Or if you're eating fast food, Mickey D's,
No.
Popeyes, Burger King, even Chick-fil-A. Yeah, I know a lot of people think, oh, Chick-fil-A is healthy. I hear that all the time.
We want Chick-fil-A today.
We're gonna eat healthy today. All right, so we know frying of food, even peanut oil, is not good. It's not good, okay? But we also have access to barrier in our insurance. We have providers that are racist. They'll treat white folks one way, black folks another way. That's ingrained in our healthcare system. I started my practice in Hapeville 25 years ago. At that time, it was primarily blacks and Hispanics, but it used to be pretty much all white at one point. But then when they moved in, they moved out. Now there's a resurgence. So now Hayesville is, everybody wants to be next to the airport now. So a lot of folks can't afford, they're building up all these townhomes, they can't afford them, so they're leaving. I say that because when I started there, my clinic was considered HRSA, Health Services Professional Shortage Area. And the providers that worked with me got benefits for working in that area. Because the federal government recognizes the disparities. They know that they need culturally sensitive care. To establish a relationship with a patient, they have to feel comfortable telling you what's going on in their lives. And oftentimes, the way the healthcare system is set up for 10 minutes face-to-face time, you can't do a lot of education about diet, exercise, stress management. You're just being a pill pusher. Add another high blood pressure pill. Oh, the hypoglycemic agent is not working? Here's some insulin. Here's a statin. All this stuff, instead of telling people, this is what you need to do. You gotta lose weight, you gotta eat better, you gotta get out there and exercise. There's nothing wrong with that. We weren't meant to be sitting around a table, around a computer screen for 8-9 hours a day. That's not how our bodies genetically was made. We need movement. We need movement. All right, so the root cause, we have the socioeconomic disadvantages, and that has a huge part to do with the healthcare disparities. So it's not all our fault. Closer? Okay. All right, so diet, lifestyle, and environmental factors. We have higher rates of high blood pressure, higher rates of obesity. Our dietary patterns are cultural. It's hard to break those habits. The environmental stressors. I remember when I first moved to Hayesville, and then I would have to go to the local Kroger that was in East Point, about a mile away, on Cleveland Avenue. I went into that to get some juice or some fruit or something. In that particular time, the produce looked old and it didn't look fresh. They had 3 aisles dedicated to beverages, all non-labeled sugar drinks. Just said soda, Coca-Cola, orange, all of this stuff. And people were just taking it off the shelves and drinking that. Sugar is one of the most toxic foods you can put in your body. It causes your insulin to go up and you store fat. So you drinking sugar, the body doesn't need sugar. The body will make sugar from proteins and fat and complex carbohydrates. You taking in simple sugar, your insulin goes sky high, the body says, okay, let's put it here, right on the belly, yeah, on the face, on the neck, put it. It stores the fat. It stores fat. Insulin creates obesity. It's an obesity hormone, right? Take that away. Because the more sugar you can't lose weight eating sugar. You're not going to lose the weight. The body will preferentially use that sugar for the brain, the muscle. So you have to avoid that. So the body uses the fat for energy. Okay? All right, let's talk about some of the genetic things. Once again, it's not our fault. You know, we were slaves for a few hundred years. We got the scraps. And we made those scraps taste good. Right? Chicken feet. Pigtail.
Chitlins.
chitlins, intestines. We made it taste good. And what do we add to it?
Salt.
Salt. Right. We make it taste good. But let me tell you this, genetically, because we're supposed to be out here working, tilling the soil, chasing down animals. Genetically, our genes cannot get rid of sodium as effectively as white folks. There's a gene, it affects a hormone called aldosterone. So we have low renin, which makes that we don't have enough aldosterone to get rid of the sodium. Just simplified version. So we tend to run higher blood pressures because of this gene. So if we know we can't get rid of sodium as effectively, why do we add salt to everything we eat? Eggs, grits, everything.
Potato.
We love salt and we love sugar. And those are the two things I want you to take away. You don't need to put those in your diet. A little bit of salt is okay. Cholesterol. Most Caucasian physicians, most internal medicine doctors are not going to check, they're just going to do a cholesterol panel. And they'll tell you, you have the bad cholesterol, LDL, the good cholesterol, HDL. They're not doing the additional testing. There's a marker in our blood, it's a lipoprotein, it's a cholesterol, that's called lipoprotein A. We have the gene that makes that high. It's an independent risk factor than LDL. A lot of us, and I checked my family, my sister has it, my brother has it. It's a simple blood test. Ask your doctor to check your lipoprotein A. It's an independent risk factor for heart attacks and strokes. How do you get it down? Number one, there's not a lot of research because it doesn't affect the majority of folks, so there's not a lot of research. Yes, they have statins for LDL, but lipoprotein A, the only thing that's been shown to be successful at lowering that is niacin, vitamin B3. And you have to take at least 500 milligrams 3 times a day to get it down. I checked mine was 230. A normal white folk will have 30 or 40. Mine is 10 times higher. So I've been on niacin, and it's come down. You don't have to eat fat for that. That's a genetic marker. So this is not a dietary thing, okay? It's not that, oh, I'm eating too much animal fat. This is in your genes. We have, a greater percent of us will have elevated lipoprotein A. So every black person should get that level checked, okay? African Americans have higher average lipoprotein A than white individuals. This is straight from the book. Biological susceptibility interplay with social and environmental factors necessitating integrative approach to risk assessment. So if your doctor's not checking some of these markers, he's doing you an injustice. But he may not even know. Not all internists know everything. So what do we have to do to close the disparity? Education. Like this. We need to learn prevention. We need to know how to eat. A diet rich in fruits, vegetables, whole grains, lean protein. That means no fat back. Lean protein and healthy fat supports heart function. You got to limit your sugar and your salt and your saturated fat to reduce your blood pressure, your cholesterol, You want to drink plenty of water. My topic today was on water. How much water do you think you need to drink and take in every day to be healthy? For elimination, for your skin, for your kidneys? How much water do you think you need to drink? 8 cups? That's the general thing.
Half your body weight.
Half your body weight, yeah. You can do it that way. But it shows that if you're a small person, you need at least 3 liters. If you're a bigger person, you need at least 4 liters, which is about a gallon. And that can include milk, juice, which you really don't want to do too much of that because of the sugar. But hydrating drinks, you can get water from watermelon,
Yes.
from cucumbers, from cabbage. All of this stuff has a high water content. A lot of food that you eat have high water content. So you want to eat more of those. Okay? So we have to do workshops, health fairs like this, church events, to get the word out so we can make the impact. And then we have to go back and measure the outcomes. Here is what happens when you have health fairs like this. Most people, you're going to increase the preventative screening rates with expanded access, which is good. Here are the policy recommendations. Some of these are in place, but Georgia never expanded Medicaid because the governor didn't want to do that. So there's a lot of people who are falling out of the Medicare, so they don't have any health insurance, right? You have to be dirt poor really to get on Medicare or disabled Medicaid. And the supermarkets have to be provided an incentive to bring fresh produce, fresh vegetables, and healthy food to our neighborhoods. And I'm not a political person, so I won't get much into that, but there's a lot of discrimination in the healthcare laws that need to be addressed. We have to look at the social determinants of health. Food access, our housing, our transportation, very important. And if we do all of that, we will get our incidence of heart disease way down. So, in conclusion, African Americans face higher heart disease incidence than other groups. The key drivers are lifestyle, the way we cook, what we eat. A lot of us are not even cooking anymore. All their meals come from outside. Yeah, those McDonald's breakfasts are not healthy. They're not. Biscuits, no, they're not good. Egg and cheese, no. Eggs are okay. So we need lifestyle changes. And I talked about the 2 genetic factors, one for the blood pressure, one for cholesterol. So if you know that, then get your levels checked and then start doing something about it. So now we need to expand our outreach, improve our preventative care, and just integrate policies. Talk to your congressman, whatever we need in a particular area to get it done. We can get things done if we work together, but educating the populace is first. And all African Americans, all the population, but since it's impacting us, my passion is for my people. And I want to make sure that, and I've been doing this for the past 25 years, of educating folks on their lifestyle, the things that they can change. Some things that can't change. Can't change getting older, can't change your genes. But you can change how those genes will impact you through your lifestyle. Eating healthy, preparing your meals. I love cooking. I love it. it doesn't take that long. It's not such a big dramatic thing where everybody has to order something to come in, DoorDash and everything. It's insane what we're doing now. You know, I cook dinner, and my girlfriend, she'll cook, and then I'll take leftovers for lunch, home cooked meal for lunch. And it always tastes better in the afternoon. Once all the ingredients and the spices are soaked in, you're ready to go and you're ready to eat. All right. So that's my presentation on heart disease and how it impacts us, but a little bit more about my foundation. I do all my presentations under my nonprofit. I started this in 2002 after my mom, who had 8 of us, she had congestive heart failure, and she died at the age of 68. She had osteoarthritis, because she was overweight. She had touch of diabetes, high blood pressure. The metabolic syndrome, she had it. And so many of us have it. And she died early, way too soon. Way too soon. So when she died, I started my nonprofit, and I focused initially on the local communities, just educating the masses. But then I got into doing medical outreach missions, and I've been to over 20 countries in Africa and South America over the last 25 years. We've treated over 30,000 people, all free of charge. So this particular, I'm doing I do this every other year or so. It's called 12 Weeks to Wellness. And I have right now over 60 people signed up for this program. And if they follow through and take heed, because you know that's the hardest thing for people to follow through, eating right and exercising, I've guaranteed them that they'll lose between 20 and 30 pounds in 12 weeks. That's about a pound or 2 per week at least. And that includes the whole thing: eating, exercise, stress management, prayer, and dealing with your stress. Why stress out about something that's not in your control? Who's in control?
God.
There you go. That's it. God is in control. Even over all the evils out there, God is still in control. So I cover these topics of detoxification, I give you nutritional guidelines, exercise. It's a free program, by the way. There's no charge for it. And how much water, why GMO foods are bad. I went through all of that. If you're interested in joining it, just leave your name and your email. We'll send you a link. It's Saturday morning. I did it this morning from 8 to 8:30, 30 minutes. And it's basically just fruits for the soul. Next week I'll be talking about supplementation and why we need it, because of the foods that we're eating are devitalized, basically. So we need to take supplements. Everyone needs a multivitamin, extra D, omega-3 for good fats, and probiotics. Those are the 4 things I tell people to take every day. Okay? I'm sorry?
Can you repeat those?
Yes.
We
You
actually
need a-
have those supplements here in this room in the back.
Yeah, you need a good multivitamin, honey. That covers all your A, your B's, your C's, your D's. There's K in there.